Well, under the lockdown regulations, funerals are limited to 50 mourners. This means that some loved ones may not be able to attend and some may not find closure. How are they affected by this? Well, to discuss the impact, we're joined via Skype by clinical psychologist Bradley Daniels. Bradley, good morning and thank you very much for your time this morning. It is indeed very tough, and particularly when you know that across different cultural practices, religious beliefs and faiths, people have all kinds of rituals that they have to perform when they've lost a loved one. This lockdown, this world we live in today makes it very difficult to find closure.
Good morning, Dan, and thank you for having me on the show, and good morning to all the viewers around the country and certainly around the world as well. I think you describe it spot on, that this is quite an extraordinary and unusual world that we find ourselves in. And of course, death, the same as births, are part of the natural developmental life stage of the human condition. At this particular point in time, around the world really, not only in South Africa, we are having to do things like funerals and memorial services in quite different ways. And that is obviously respecting the lockdown rules of the various jurisdictions around the world and certainly in South Africa. So what this then means is that we now have quite unusual ways in which we are having to almost farewell to loved ones, and also unusual ways in which we now have to process grief. So, for example, just to start giving us some ideas, we start looking at what's happening around the world in places who are a little bit more ahead of the curve than South Africa, where certainly there have been more deaths than what we have seen in South Africa, where we see in places like Ecuador, where funeral parlors are unable to keep up with burying people that are dying in certain districts in that part of the world, where certainly people are actually having to make their own funeral arrangements in terms of getting their loved ones into, not only into funeral parlors, but also into cemeteries. We're also looking at another situation, which is when we talk about the COVID-19 curve, we certainly also have to look at the COVID-19 curve on different spheres of the front line. So we haven't started in South Africa to really start experiencing what that curve looks like. For example, when we start looking at people who are undertakers, who are indeed going to be responsible for helping us with the funeral rites and all, again, the safe hygienic ways to bury our loved ones, but also to be quite clear, to help us to contain biohazardous material. So that's the different circumstances under which we are having to bury.
And Bradley, the psychological impact on the workers who are in the front line. I saw a picture the other day in the media of a small group of family members and healthcare workers, you know, those who've helped to prepare the body of somebody who passed away from COVID-19, you know, handling the coffin to go and do the burial at the burial site. I mean, ordinarily, a nurse or a healthcare worker wouldn't be involved unless they were a member of the family in the burial. We must not forget that they also need psychological support.
Absolutely, Dan. I think we cannot even begin to describe the levels of trauma that we are finding ourselves in the world currently. And I think particularly also the levels of trauma when it comes to particularly those that unfortunately will be losing their lives due to COVID-19. If we just also listen and sort of start to connect with stories we're hearing from different parts of the world. In South Africa, our numbers, if I have the numbers more or less on average correct, today we're sitting on about 200, roughly 250 plus figures. And so between you and I, Dan, I think it's almost a safe bet to say that we probably don't know anyone personally yet of those 280 odd people that have already passed. But certainly for those of us connected to other places and other people in other places in the world who have actually already lost people due to COVID-19, the reality suddenly changes quite drastically. And I think for health workers, currently we are experiencing quite a challenging time, particularly that nurses and doctors in the ER setups and in sort of the ventilation spaces or in the ICU spaces that people eventually will succumb to COVID-19 are having to face extraordinary moral dilemmas, as we are hearing, having to decide which patients they should try and afford and a semblance of life to, and which patients actually really have to let go in order to make space for the next patient which may need that particular facility. That is an incredibly difficult position to put any healthcare provider in. In addition, I also want to point out that as we have not really reached the highest levels related to the number of deaths in South Africa, we haven't started to see nearly enough of the potential complex trauma from a mental health perspective, which we are likely to see with COVID-19. If we even start looking to places like New York City, where we are seeing that the bodies are inundating the city itself, and that bodies are being kept in cold storage trucks. And just recently, we actually saw that funeral parlors were running so behind that they were actually choosing to just rent ordinary U-Haul trucks, which would just be ordinary sort of trucks for hire, to just keep bodies until they can actually prepare them. So that is a really dire situation for us to look into. And I think as South Africans, we really need to start considering that we are seeing this happening in other places in the world. And this is why the lockdown regulations are actually really quite important, to try and just avoid us from getting to that level of the pandemic. And, you know, that level of the pandemic is also likely to really be incredibly difficult on the economy, because what trauma and complex trauma particularly does to individuals is it actually renders them almost disabled from a mental health perspective, where we will see various different almost comorbidities looking like depression, anxiety, and certainly just trauma, which really will make it difficult for people to actually function as we normally would expect. So in essence, what we're saying is we'll find that also a lot of workplaces will struggle to have talent which are able to be performing at the level that we usually expect them to perform.
Thank you very much, Bradley Daniels, clinical psychologist. There's some insights about the challenges we're facing now in terms of grieving and mourning the loss of loved ones.